One, two, three. Good morning. My name is Dr. Shadi Mahmoud, Professor of Dermatology in Azhar University, Cairo. This workshop, sponsored by Tower Beauty, I will talk about the Again device. Again device is a combination of alexandrite and Indiag wavelengths. So I will talk about laser hair reduction in details regarding alexandrite and Indiag. And after that, I will talk about what's beyond the laser hair reduction regarding Indiag, because Indiag we can work by Indiag in different indications beyond the hair reductions, such as vascular, wart removal, many indications. I will talk about that. So let's go for laser tissue interaction regarding laser hair reduction, because here our target is melanin. As you know, melanin present in hair shaft. But my target is not melanin. My target is to affect bulge or dermal papillae, the stem cells, the cross centers of hair follicle, to get the affection or longer term hair reduction. So my chromophore is melanin. My action is photothermal. Of course, it's thermal action to induce vaporization of hair shaft and the thermal affection to stem cells. And my target is bulb and dermal papillae. What's the key point of efficient laser hair reduction? Of course, through selective photothermolysis, we generate thermal affection to melanin, and we need to make a diffusion from melanin to stem cells to affect stem cells. Our successful outcome is to change complete and temporary hair loss during action of laser into the final results, which we hope partial and permanent hair reduction or longer-term hair reduction about 70 to 8% down, delay in hair growth, and of course thinning of hair shaft. This outcome, what's expected outcome after around 7 to 10 sessions for normal being people. Regarding vascular, of course, my target here is not melanin. My target is hemoglobin and blood vessel wall. I use hemoglobin present in blood vessels to diffuse the thermal affection from RBCs into blood vessel wall to induce coagulation of blood vessels. This mechanism of action also photothermal reaction. Let's go at first for hair reduction. What's the factors affecting laser hair reduction outcome? We have two factors: technology, which is represented by device, and patient. Regarding technology is something like driving a car. You should know about every point in your car, every specs regarding your device. You should know about wavelengths, which represented by a device, alexandrite, YAG, diode, whatever the device we use. Fluence, pulse duration, it's the duration of pulse or thermal affection. Frequency, which is represented by a repetition rate, how many pulses per second. And of course, spot size, in addition to cooling affection, which is very important to protect the epidermis throughout the session. I will talk about in details about Again device from Tower Beauty or from Deka company. It's an Italian company. First version called Again. Second version now today is called Again Pro because they exceed the power of the device. I will explain why they raise this power. At first, you should know about the specs of your device. Specs is very important to compare device from other devices or to know how the power you have in your device. So you should know what's the largest spot size. To get the good device, you should have large spot size, and to get you high range of fluence at short pulse duration and at high frequency, because many devices at short pulse duration and high frequency, we get a limitation of fluence. So you need high power device to guarantee higher fluence range at short pulse duration and at the same time at high frequency level. Something very important to know. How can I know that? The upgrading of Again device from 10 kilowatt to 20 kilowatt make make me have a high range of fluence. As you see here, at 30 millimeter, here, 30 millimeter spot size, the largest spot size in the market actually, and at short pulse duration, the maximum range I have 4 joules per centimeter square. This is the maximum fluence in this device. But in the Again Pro, I succeeded to reach up to 8.5 fluence. It's something very good, something give me more affection for hair follicle. At large spot size, at short duration and at high frequency, something very complicated to know about that, but make the device very potential for hair reduction. Again, at high frequency, 4.5 hertz, very speed, 4 pulses per second is something need you be professional to change your hand or handling the device on the skin of the patient. So again, at 30 millimeter in this device, at 4.5 hertz, high hertz, the maximum fluence 4. At the same time here, at the Again Pro, 8.5 maximum fluence in this device. The Again device, we have 2 wavelengths. The first is alexandrite in yellow color, in Diag in yellow color, and the alexandrite in blue color. What's the difference between Alex and Diag? It's something should you know. It's a matter related to affinity to melanin. As you see here, depth, the Diag is longer than alexandrite because it's an infrared range, as you see here. So we have a concept of as long the 1064 or the wavelengths, we have good penetration depths. Alexandrite is short, so it's short in penetration depths. Regarding fluence, when you use alexandrite, the range of fluence from 8 up to 14 joules per centimeter square. But in Diag, we need to increase fluence because in Diag is lower in absorption to melanin. As you see here, is lower compared to alexandrite. So you have to increase fluence to get the maximum effect of Diag. Because alexandrite is higher affinity to melanin, so no need for higher fluence. The ideal range is from 7 or 8 up to 14 joules per centimeter square. On the other side, in Diag, the ideal range is around 18 to 30 joules per centimeter square. Regarding melanin, the higher affinity related to alexandrite. Here, the alexandrite has higher affinity compared to Diag, so the alexandrite is ideal for fine hair. When you deal with fine hair, with later sessions of laser hair reduction, the alexandrite is perfect for fine hair. Still the challenge with Diag because Diag has less absorption by melanin, so you have to increase fluence. Sometimes it makes risk for patients. Regarding safety, of sure, Diag has higher safety compared to alexandrite because has less melanin absorption, so has more safety on the epidermis because we have melanin in the skin and in the hair follicle. So we need, when you deal with darker skin type, you should select Diag to guard safety more than risk. Regarding fluence, second option in your device, you should know about fluence. Fluence is a temperature level because when you increase fluence, you increase the temperature level on the hair follicle, in turn the stem cells of the hair follicle. So adjust the fluence according to amount of chromophore, of hair color and hair density. When you deal with fine hair, you should increase fluence. When you deal with coarse hair, you should select moderate fluence. When you deal with first session with my patient, when the patient has coarse hair, I start with moderate fluence, something in like 10 joules centimeter square regarding alexandrite. After 2 sessions, the hair follicle lose the chromophore, being lighter, being finer. So we should, in such a case, to increase fluence more from 10 to 11. After 2 sessions again, increase up to 12, 13 joules per square. As the hair follicle lose chromophore, you should increase fluence. And the perfect fluence give me a mark of perifollicular erythema and edema. After few minutes, we have perifollicular reaction, and sometimes difficult to see it in darker skin type. It's easier in fair skin type or in short pulse duration. We can notice perifollicular reaction. It's something good for me, meaning that I used perfect fluence. This is the sign of perifollicular reaction. As you see here, optimal endpoint you should have vaporization of hair shaft at first, perifollicular erythema and edema after a few minutes, singed hair on skin and smell of burned hair. All this means that I used my perfect fluence. Fluence, as you see here, joule per centimeter square because it's correlated with the spot size. Higher energy allows wide range of fluence thanks to 20 kilowatt of Again Pro, because this megawatt make me use large spot size with good range. To explain that, see here this some numbers, but it's very important to know. Let's go to 24 millimeter spot size. We have maximum joules here around 14 regarding alexandrite, and the maximum joule around 20 regarding Nd:YAG. This 24 millimeter. You can compare it to another devices. This is the old Again. But in the Again Pro, something totally differentiated from the post 20 kilowatt makes this more advanced. 30 millimeter, change it from 4.5 joule up to 8.5 joule at 3 milliseconds and at higher hertz. That's increased usage of 30 millimeter. Especially I prefer it for chest, for back, for size, because it has long penetrating affection. Not recommended for face, not recommended for forearm, not recommended for sensitive area. Please, when you use large spot size, use it for thick skin, chest, back, and size. Reducing the time of treatment session. Of course, 30 millimeter will save time. I can do full body in 20 minutes because I save time and chest wide areas and size. Increasing efficiency give me less treatment sessions. I can do my perfect affection in short treatment sessions, up to 7 or 8 sessions in normal being people, because in hormonal imbalance, it's something totally different. Third item I speak about wavelengths, fluence. When it comes to pulse duration, it's the duration of pulse. It's something related to hair follicle size. What's the meaning of that? When you deal with coarse hair, please select long pulse duration. When you deal with fine hair, please select short pulse duration. It's something related to laser tissue interaction and thermal relaxation time. It's something sophisticated to explain it. So, simple way, adjust duration according to hair follicle size. When you deal with coarse hair, it's recommended to start with 20 or 25. After 2 or 3 sessions, when the hair follicle being finer, down to 15, down to 10, and the late sessions, sometimes we need to reach up to 5 or 3 milliseconds to be succeeded to target the fine hair. This is the idea of how to adjust pulse duration according to hair follicle size. When I told you about fluence, we need to increase when hair follicle being finer or thinner. And vice versa in the duration. You need to decrease while the hair follicle being finer. Of course, sometimes we need to down up to 2 milliseconds. It's something very sophisticated. What's the device? Many devices, when you down to 3 milliseconds or 2 milliseconds, the range of fluence could be reduced. But in this device, we have large or high power, make range of fluence be suitable for every size of hair follicle, even very fine. Let's go to frequency. Frequency meaning that repetition rate, how many pulses can be generated by your handpiece. Take care with high frequency, please, because high frequency needs someone professional to handling, to move correlated with repetition rate. So the ideal is to make overlap about 10%. But in high frequency, if you not professional, sometimes we do some overlapping more than
just the time 5 minutes
1 hour
1 hour
the workshop
30 minutes 30 minutes 30 minutes
10 minutes ساعة ونص ده انا عاوز اقلل انا هقلل انا مش هو عذرا الورك شوب معموله ساعه ونص بس انا مش هقعد ساعه ونص ما تقلقوش يعني الموضوع كله هيخلص في خلال 15 minutes باذن الله. انا بقى اتفاجئت انها ساعه ونص يعني. So try to avoid overlapping please because this matter could cause burn for patient and sometimes in high frequency you can make many spaces or missing areas. So if you're not professional please work by low frequency 1 hertz 2 hertz 2 pulses per second to be sure to avoid stacking or missed area. You should train enough on high frequency pulses. This model of comparison between different devices, if this 3 devices compared to again, when you use 24 millimeters, the maximum fluence we have in alexandrite here is 11, here is 10, and 14 in the again. In again pro, we can reach up to 20 joule per centimeter square because the mega power of the device. Again, we can compare again the old version and the new version. 30 millimeter here give me 4 joules maximum for Alex, and here 8.5 maximum in 30 millimeter for again pro. This short video this 30 millimeter spot size, as you see here, and frequent high 3 hertz, 3 pulses per second. It's recommended to use it for back or chest because it's a wide area. It consumes many pulses, as you know, consume time. So here we can finish this area in around 2 minutes or 3 minutes maximum. And after this, the pernet here on the skin. And this reaction we should to get, which is perifollicular reaction or perifollicular erythema and edema. Regarding spot size, Deka invented the model of spot size which is characterized by top hat. What's meaning of top hat? Top hat meaning that can generate thermal affection or laser beam all around the circle in the same energy. But some devices generate the pulses in Gaussian beam. Gaussian beam meaning that the central is efficient and the periphery is weak. So you should make overlap more than 10 to up to 20% for the spot size. So top hat save pulses when you use this technique. We have in the again device invented or something new which is called Moveo. It's a first contact alexandrite or first contact NDAG. It's a contact device. Make me use low fluence in high frequency range. This is a new theory of cumulative photothermolysis. We can use it for hair, we can use it for rejuvenation, for vascular, and for pigmentation. And also again pro maximize the energy from 60 watt to up to 80 watt to make it more faster, about 25%, and they make the range of fluence is better than the old version. This is the shape of Moveo device or spot size. So we have 2 models here, conventional and motional. Conventional is a traditional laser hair reduction which depends on high fluence, low frequency, single pass, depending on selective photothermolysis, and makes sudden rise of temperature to induce burn for hair. On the other sides, we have low fluence, high frequency, repeated passes to induce cumulative photothermolysis, and here we have gradual heating up because we move back and forth to make gradual heating up to damage of the hair follicle. This is the idea of cumulative photothermolysis. This is the optimal endpoint for motional technique, mild to moderate erythema after a few minutes, smell of burned hair, patient discomfort with pain little bit, peripheral erythema and edema as same as conventional. This is technique. How can I move? Circular or linear? But in one condition, you sure to generate this thermal action in very small area, 10 by 10 centimeters square. It's very important. Every 10 by 10 centimeters square, we can change it to another area. And the end point, as you see here, peripheral erythema and edema, even with low fluence in high frequency range. Some cases before and after, as you see here, even with finer hair, we can use high range of fluence because we have big energy from our devices. And let's go to some factors affecting laser reduction regarding patient. I speak about technology. We have some issues with our patients. I selected some challenges, how to overcome. First issue we have leukotrichia after laser hair reduction, as you know. Sometimes when you deal with patient around 35 to 45, she has the ability to white hair, so please take care from this. The light absorbed, the explanation of that, the light absorbed and that produced by melanin may be sufficient to destroy hair, but not sufficient to damage stem cells, but sometimes insufficient to damage hair follicle. So hair follicle, when induced regrowth, will be white, and this is something, no solution for that, as you know. Who already have a few white hair in other areas as a scalp, it's a mark that the patient has the ability to has leukotrichia. So take care from that. What's treatment plan here? Higher fluence for patients more than 35, or the patients has any white hair in scalp or in face, and we can do repeated passes. Yes, we can do repeated passes to maximize energy. First pass, and then give rest for patient with ice packs, and then re-again your session in the same area. Not stack. It's called it as a pass, not a stack. Stack is the same area. You shot twice or triple on the same area. It's something induced burn. Second issues we have is paradoxical hypertrichosis. We have two situations here. First situations, when you deal with this area, after 3 or 4 sessions, the patient complained about paradoxical in the other area, in the area around, in the periphery of the face and the neck. It's something could be related to hormonal imbalance. It's the first situation. Second situation, in the same area I treat, the same area shows thickness of hair from fine to be terminalized into be thicker. It's something that could be related to suboptimal fluence. This two situations. Maybe first situation may be due to undiagnosed BCO or improper cooling. Cooling here should be on the treated area, especially on the around area around the problem. And when you have this problem, this is my plan of treatment. You should continue treatment and inclusion new hairy area in addition to treatment area. Cold packs, please, around the area you treat. Make 2 passes. Again, you can here make 2 passes. There is problem with 2 passes because you will give a rest for patient about 5 minutes, and notice if any persistent erythema or well-defined erythema. If you found well-defined erythema, give more relaxation time, up to 10 minutes or 15 minutes. Or you can use Moveo handpiece, because Moveo handpiece can generate low fluence in high frequency up to damage point of hair follicle. It's something safe. And you can, in such case, decrease interval between sessions up to from 1 month down to 3 weeks. Second situation, which is related to suboptimal fluence, I do recommend to increase fluence. Check power and losses from your device. Sometimes the problem in my devices. Making 2 passes with laser during treatment again, and you have Moveo in this device to be safe to increase accumulation dose of thermal energy from laser. Another issue which about focus for dyes after laser, some cases we noticed that the complaint about focus for dyes. What's the explanation of that? The laser is said to damage follicular infundibulum, leading to epidermal detachment and delayed keratinocyte maturation. This is the explanation of pathogenesis. What's plan of treatment here? Low potency corticosteroids, topical clindamycin, topical upon tacrolimus, isotretinoin in low dose, microwave device sometimes we need. Another issue we have, hyperhidrosis. Some patients come to me after 3 or 4 sessions complained about axillary hyperhidrosis. What's the explanation of that? Deep going theory could activate sweat glands lying near the deep terminal hair pulps of axillary region. So here in such case, we did a stimulation. Some publications revealed that sometimes patients noticed improvement of hyperhidrosis, but it's a low number of papers. But the most of publications said that stimulation of apocrine glands could be occurred after laser hair reduction. So patient came to me complained about hyperhidrosis. What's the plan of treatment? Avoid exercise and hot showers for at least 24 hours before laser removal is very important. Antiperspirant, of course, botulinum toxin can work in such a case. Another problem which is bromohydrosis. It's a change of a smell of sweating. With hair removal, bacteria start to colonize the skin, resulting in a change of flora. It's a problem of a change of flora in the axillary area. So in such a case, we should do hygiene modification for first line of prevention and treatment. Showers, laundering, antiperspiration, not reusing dirty clothes, topical clindamycin and erythromycin could treat. Tanned skin, please don't touch. I don't recommend it to work with tanned skin. It's because they have liability, high liability for burn. Or if the patient insists to work with their tanned skin, it's recommended to use Moveo handpiece because Moveo handpiece work by low fluence and high frequency in repeated passes until accumulation of thermal affection for hair damage. How to be safe in skin of color. In our region, as you know, we have skin type skin type 4. In Egypt, we have 3, 4, and 5. So it's recommended to use longer wavelengths, longer pulse duration. It's safe more than short pulse duration in such a case. Low fluence, proper cooling, and motional alexandrite is perfect because motional alexandrite, yes, it's aggressive sometimes for darker skin type, but still motional or Moveo can work in darker skin type in safe way because in such a case I used low fluence. This is my application. 2 years ago, I published comparison between a longer pulse in the egg and the Moveo alexandrite in axillary hair reduction in darker skin type 5, 4, 5, and 6 in this publication. And we found that motion alexandrite be efficient and safe more than longer pulsed in the egg. This is my publication. As you see here, it's a multi-pass low fluence high frequency. This is a technique of Moveo compared to traditional or conventional 1064. Thin hair in dark skin type is the biggest issue we have. It's a challenging case because thin hair in darker skin type, thin hair you have to increase fluence, but the patient darker in skin color. Thin hair meaning that you should select short duration, would sometimes be aggressive on darker skin type. So it's something very challenging. What I do recommend, you can use longer pulse in the egg in short duration because in the egg is still safe. You can use Moveo alexandrite, even alexandrite wavelength is aggressive, but still in Moveo technique we can use low fluence and short duration, or you can use key switched in the egg as a shaver. Yes, it's not give a longer term hair reduction, but still it's safe to use it in شعر الوبري or very fine hair. We can use key switch in the egg to damage hair follicle. Again, beyond the laser hair reduction, it's the zone of professional level because when you use in the egg as for vascular, it's something need to be trained well about it because in the egg is weak for vascular, as you know. When something weak, you need to push to maximum power, and this something could cause problems sometimes. We can use it in onychomycosis, wart, acne, vascular, many indications. So first indication I do recommend, it's telangiectasia, facial telangiectasia, by using small spot size for small blood vessels, as you see here. If a spot size is blood vessels is larger little bit, we can use 5 millimeter. So in facial telangiectasia, it's recommended to use 2.5 up to 5 millimeter. We can use here duration suitable for the size of blood vessels. When you have small blood vessels, it's recommended to use short pulse duration. When you deal with large blood vessels, you should select large pulse duration. And here I used around 550 joule per centimeter square. This the endpoint we need to achieve. Something like a change of color. Just a change of color is a good endpoint for me, from reddish to bluish or some blanching. So please take care from the change of color, because it's something meaning that you're doing well. Infraorbital veins, it's something challenging because it's a sensitive area. Take care, please. You should do traction to scan downward to make the vein away from the eye. Because NDAG has higher penetration depths, up to 7 millimeters, so sometimes can reach up to eye. So please stretch skin downward and work pulses, then doing cooling, interval between pulses, not make pulses in successive way, please. Make a rest between every pulse, and use ice packs after that to guard against any burn in the skin. Here I used 80 joule, used 20 millisecond range by using 5 millimeter spot size, because here we have larger little bit vein. I can use it for port wine stain. Port wine stain, especially in hypertrophic port wine stain. As you see here, it's hypertrophic and it has he has anedules. So I prefer in such a case to use NDAG 30 to 40 joule, using 10 millimeter to give me good penetration depths, because it's a second hypertrophic port wine stain. Regarding biogenic granuloma, yes, we can use the NDAG as a damage. Here I doing cool off, cooling, no cooling here, 70 joule. I can use stacked, one pulse, second, third, in successive way. This is called the stacked pulse, because here I tended to doing damage for biogenic granuloma to induce coagulation and doing coagulation for feeding blood vessels, which is the results after one session. Venous malformation, it's something shows some challenge because it's deep vascular level, and here we should use NDAG, not pulsed dye laser. Pulsed dye has limitation in penetration depths, but NDAG I can reach up to 7 millimeter down into dermis. So here I do recommend to use spot size something like 7 millimeter or 10 millimeter or up maximum 12 millimeter to give you good range to affect this deep lying blood vessels. Even the same for venous lake. Angiokeratoma for dyes, we can use also NDAG laser using 5 millimeter. Leg veins, sometimes we have some complication with leg veins, something like pigmentation or some crustaceans, so take care. We depend on endpoint, please, which is a change of color or some blanching for blood vessels. As you see here. And this is my recommended protocol. I do recommend it to use it, or we can take a picture for that. When you deal with small venulactesias, very small, less than 0.5 millimeter, please, I do recommend to use 2.5 millimeter. The range of fluence here from 170 to 230 joule centimeter square, and here I prefer to use short pulse duration. Regarding spider leg veins, it's a little bit bigger than venulactesias. I do recommend to use 5 millimeter. The range here is 100 to 150. Start with lower range and see if you see endpoint, continue. If you don't see endpoint, please raise from 100 to 110. If you don't see, 120. Till once you see endpoint, continue the same fluence, please. And here, the range for duration is 20 to 30 milliseconds because it's larger. It's the same concept of hair follicle size. Increase duration according to blood vessel size. Regarding reticular veins is larger, up to 3.5 millimeter sometimes. Please here use 5 millimeter, start with 100 joule, and here please increase duration to be suitable for larger reticular veins. So it's something very important to modify your settings according to the shape of blood vessels. Here, to make it clear for you, please see the first video. Please notice here what's happened for the vein. It's puckering, something like atrophy. It's something means that I aggressive. So I don't recommend it to induce puckering for the vein. But the first video, here, we had a change of color, just a change of color. This is ideal, this is perfect. When you see that, continue the same parameters, please. And this is the shape of reaction occurred after laser affecting leg veins, some ecchymosis, and heal after 1 month. So when you repeat your sessions, please make interval up to 1 month, 1 month and a half. Rosacea, we can use Moveo vascular. It's a good handpiece for small blood vessels. We can use NDAG using Moveo handpiece in repeated passes. A wart, I do recommend to use NDAG for wart as a damaging option, something like what I did for Bergenic granuloma. Here I paired the wart at first to reduce the hyperkeratosis, then doing up to 3 or 4 stacked pulses in the same site. And this my publication compared pulsed dye and the NDAG. And the results was perfect for pulse devices, but better with NDAG, and DAG shows less recurrence rate compared to pulsed dye laser. Even with genital wart, we can do NDAG. In onychomycosis, we have a good mechanism of action here, which is a maintained thermal action on the onychomycosis to affect fungal cell wall. We can use 30 or 40 joule in long duration up to 35 milliseconds, 1 hertz, and 5 millimeter, but it's recommended to use multiple passes. When patient feeling hot or pain, stop, give him around 2 minutes, then continue again to induce thermal affection, because as long as you increase the thermal affection time, you will get good results. Or you can use 35 joules, the same fluence, in 5 milliseconds, short duration, but in high hertz, 3 hertz, to induce rapid thermal affection for fungal cell wall, and they keep going to repeat passes till patient feels pain, stop, and repeat again, feel pain, repeat again, to up to 10 minutes, please, because fungal cell wall, to get affected, we need time of exposure of thermal affection. This, the pattern of generating pulses, as you see here, we cover all nail plate and nail fold. Mechanism of action here could be photothermal affection, stimulation of local immunological reaction, the second theory, and the laser can induce free radical formation and activate cellular metabolic process. This mechanism of action, these are some cases before and after. We can use NDAG for acne, yes, because acne has penetration depths up to 7 millimeter, can reach up to sebaceous gland, and can reduce sebaceous gland activity. So we can use it in such dose, 35 joules centimeter square, duration up to 30 milliseconds, to induce photothermal reaction deeper in the tissues using 10 millimeter. Another case, rejuvenation we can use because YAG is still seawater. yes, it has weak absorption to water, but can affect collagen by repeated passes, especially when you use Moveo skin rejuvenation handpiece. This Moveo for rejuvenation. We can use alexandrite for pigmentation, sometimes for epidermal pigmented skin lesions. We have different modalities, different options in the Again device. If we wanted to have all options, we can get Moveo pigmentation, Moveo hair reduction, Moveo vascular, Moveo skin rejuvenation, in addition to conventional use of alexandrite or NDAC. So Again Pro, to gain efficacy and safety, we have here highest power in the market actually, fast speed of action, the less pulse duration we can use to get affection to fine hair with good range of fluence. Moveo technology we have, safe and painless Moveo technology, and the device has low maintenance cost compared to other devices. Thank you.
Thank you, Dr. Shadi, for this nice and informative information about this type of laser. It is a little bit long lecture. Thank you.
Thank you.
Now we will start with discussion.
لا هي بريك.
Yes, yes.
هو السيشن طويلة.
Okay.
هي ساعة بس طب ممكن كده بريك.
Okay. Any question for Dr. Shadi?
Good morning. Thank you for this comprehensive explanation about the laser. I wonder, for the hyperhidrosis as a complication of the post-laser, is it a permanent or temporary complication? Thank you.
Unfortunately, sometimes persistent. So you have think about potent toxin injection for such cases.
Any question? Another question? Okay, thank you, Dr. Shadi.
Thank you, Dr. Shadi, for nice presentation. But regarding the using of laser for water removal, there is some new studies regarding the developing of recurrent laryngeal papillomatosis because of using of the laser for removing the warts. So I don't recommend for using laser for removing for the warts because of this risk. It's a great one.
Again, sorry?
Developing of recurrent laryngeal papillomatosis during using of the laser for removing warts.
I do recommend NDAC and pulsed dye for this point because less fume can be generated during NDAC and pulsed dye. The problem with CO2 laser, the problem with cauterization, because in such a case you have great fumes, so you should have a vacuum or smoke evacuator. But with NDAC and pulsed dye, the least fume can be generated. Don't worry.
Okay, شكرا دكتور شادي.
شكرا.
شكرا. First speaker Dr. محمد أبو